Hello, this is Dr. Stephen Pipe, Professor of Pediatrics and Pathology at University of Michigan, and I'd like to summarize the Phase 3 Hope B trial of etranacogene dezaparvovec in severe, moderately severe hemophilia B. This was a post hoc responder analysis of participants who received full dose and responded to treatment. So etranacogene is a liver-directed AAV5-mediated gene therapy. It delivers the highly active Padua variant of factor IX, and in the Phase 3 Hope B trial, it met its primary endpoint, showing a 64% reduction in annualized bleed rate from months 7 to 18 that was superior to that observed during a lead-in period when subjects were on their standard of care prophylaxis with factor IX. And on the basis of this, it went on to several regulatory approvals. Now, to remind you, this was a single-arm study in adult males with factor IX activity less than 2%, but with and without pre-existing neutralizing antibodies to AV5. There was, after the lead-in period, they all received the dose at 2E13. There was no prophylactic immunosuppression, and the endpoint for looking at efficacy between months 7 to 18 was used because that's when patients had reached their stabilized factor IX levels and were off any reactive immunosuppression. Now, the full analysis set for this study was 54 participants, but there were 2 non-responders, and one who had the highest AV5 neutralizing antibody titer of 3,212, and another one who only received 10% of the dose due to complications associated with an infusion reaction. So what was done in this analysis, this was a responder analysis, and a responder was defined as a participant who demonstrated factor IX gene transduction with expression of factor IX that allowed discontinuation of prophylactic factor IX infusions. And then this was compared to their lead-in period. And now from months 7 to 24 months, post-treatment in this population, there was a significant reduction of 76% in their mean annualized bleed rate. In addition, it reduced ABR in all bleed types for these Hope B responders, and it also showed an increase in the number of responders with 0 bleeds, where the 0 treated bleeds increased from 30.8% during the lead-in period on factor IX prophylaxis to 67.3% between months 7 to 24 in the treated responders. The mean factor IX activity has remained stable and durable in these study responders. The mean factor IX activity at 6 months was 39%, at 12 months was 41.5%, 18 months 36.9%, and at 24 months was 36.7%. All 52 of these responders remain free from routine continuous factor IX prophylaxis over 24 months, and none of the patients have experienced a treatment-related SAE following administration. So overall, I think this gives maybe a better picture of how we talk to patients, what the expectation should be if they receive etranacogene dezaparvovec with a lower NAB titer than this one individual who was not a responder, and if they get the full dose of the infusion. So this is helpful information in how we talk to our patients. Thank you.